Okay, phew, all right. Okay, hi everybody. Welcome back to class and middle of the week. So almost through this week. I think October is the hardest week. It's spooky month, but at the same time we don't actually have like Halloween isn't really a holiday, so or we don't get a day off from that. So I think at least for me it's I think yeah, this is probably the hardest part in the semester because we have full weeks all of October. All right, so let's try to finish up the axial part of the skeleton, right? This today. So that's what we're gonna. I can't English today. All right. All right. So then this is the part of the most of the axial skeleton because again we did cover the hyoid, which you don't see here, and if the hyoid was there, it would be floating around here, and also the external the auditory ossicles that are inside your ear. So we can't see that in this view of the axial skeleton, but this is showing most of that. Okay, so average score for exam 1. Now, the thing with average scores, like when I used to say average scores in the past, the students who end up below the average, sometimes they're kind of shook and they're like, they kind of despair. So I don't divulge averages because out of consideration for that. But usually in past years, the averages were around 70% for exam 1, and this year was lower. That's all I'm going to say regarding to that. So that's why I'm not going to say the averages because it's like for people, I mean, everyone who's above average, they're happy, but 50% of the class is going to be like, oh no, I'm below average. So I'm sparing them that part. So it is a little lower than previous years when we were in person, but again, there is still room, and that was like there's still all the pack back questions, the quizzes, the homework, and 2 more exams. So again, yeah. But if you're above 70%, you're definitely above average. But I'm not gonna say the exact percentages. All right. Okay, so Monday lecture, it's not up yet. It should be up. Let me check. Let's see, studio. Where's the content? I mean, it should be up. It's not up? Oh, it's still unlisted. Oh, weird. Okay. I'll set to listed now. All right. Okay. All right, enough of business. Let's get back to what we want to talk about. Okay, the vertebral column. So what do we have that? So the spinal column or the vertebrae make up your spinal column, and this is what we call the vertebral column. And there's major regions. There are 5 major regions, but notice that as the sacrum and the coccyx, they actually start out in development as 5 different vertebrae, but as you develop, they start to fuse together to form one bone. So again, like when we start out in the womb, sometimes our bones are separate, but as we develop into and mature, these bones end up fusing. So what we see here is that, now do I expect you to know that the sacrum is made out of 5 and the coccyx is made out of 4? Maybe that's nice to know, but I think in terms of like, if you're studying but developmental biology and embryology, or if you're going to pediatrics, maybe that's more important, but for this class, just know the sacrum and coccyx. But in terms of the rest of them, they shouldn't be fused. So what we have are 7 cervicals, 12 thoracic, and 5 lumbar. And again, this is why you need to know your landmarks because they pay off, especially with the skeleton and muscles. Now this also leads to one of my favorite mnemonics of all time. So it's breakfast at 7, lunch at 12, and dinner at 5. And I love this because it tells you exactly how many vertebrae you normally find in these regions, and it goes in order. I don't like mnemonics if they're just kind of random and all over the place, but this has multiple layers to this one. Okay, so then for this one, for the cervical vertebrae, so how do you number it? You number it from superior to inferior, so starting from the top and going and near the skull, going down toward the coccyx. So as you go from superior to inferior, you count up in numbers. So the first cervical vertebrae, the most superior of them all, is called the atlas, and it fits onto the next cervical vertebrae called the axis. And this is how it fits here. So notice in this picture, you don't see this ligament. So I know labs are online this semester, but some students would be like, wait, isn't the hole in this axis way too big to fit onto this small little post this ends here? Well, again, when we die, these soft connective tissues end up decomposing. So what you do find in your body is that there's actually a ligament that holds it in place. And the axis has this little post called the dens. And the dens is the same root word as like dental. It refers to a little, so it's like a little tooth that pokes up from the superior surface of the axis. And the dens of the axis is like a little post that the atlas rotates around. So there's actually a transverse ligament that spans the inner part of this atlas. So it kind of helps hold the atlas, the posterior part of the atlas, snug against the dens of the axis. So what happens here is that you also have the superior articular surfaces. So again, remember articulation referring, when we're talking about skeletal anatomy, is where two bones touch. So these are actually smooth because why? Well, here's what sits on the atlas. So your skull sits on the atlas, and what you have here is that these occipital condyles, and remember condyle is that kind of bumpy protrusion that's like a knuckle. So what you have with these superior articular surfaces is that you have this knuckle and this kind of like gliding across this superior articular surface. So it's important to have the hyaline cartilage there, but that's why these surfaces are smooth. So when you're nodding your head like this, your occipital condyles are gliding across this superior articular surface of the atlas. Is there a disc? Not really, because yeah, these are different than that. Okay, so if you know Atlas or Greek mythology, so if this is in New York, the Atlas sculpture is like Atlas holds up the world. Or if you read that book in high school and that one friend ends up really liking for some whatever reason, and then you play BioShock and you find out why Ayn Rand is totally like not a good idea. Well, think of it this way. Instead of Atlas holding a globe, what you have is Atlas holding that big globe you call your head. So this is what I think of it. The skull, it sits on Atlas. Atlas holds up the world. Atlas holds up your head. Now, what does Atlas sit on? So Atlas sits on an axis. So when you think of like a rotational axis, like the rotational axis of the Earth, it's that imaginary line that the Earth rotates around, right? Or if you have like a top, it rotates along an axis. Or if you have someone spinning, they're rotating along an axis as well. So what we have with axis is that this is your C2. So what we have here with the axis and your dens is that the atlas sits on top and it's able to rotate across this axis. And again, the dens is the little post that helps to, there should be a ligament there, but this is how you're able to rotate your top cervical vertebrae. It's from the atlas rotating around the axis. Okay, all right. Now the rest of the cervical vertebrae, C3 to C7, they kind of look, so the atlas and axis are differently shaped from the C3 to C7 vertebrae. So this is showing a typical vertebrae below the C2. So this is like a sample from C3 to C7. But what do you notice? Well, you notice that there is a vertebral body, and then you also the foramen and what runs through this foramen? Actually, your spinal cord runs from through these little holes, and you also have these lamina, and also basically you have all these bony casings. And what we have here is that this is the part that supports a lot of the weight, and this is where the spinal cord runs through. You also have all these processes and also these foramen. So there's also these costal processes because the vertebrae, they not only hold up and support weight, but they also form like at least the upper vertebrae in your body. They articulate with your ribs, allowing your ribs to move or support your ribs, but also allowing them to glide and pivot as well. So I like to think of it this way. When you're looking at cervical vertebrae and from the superior view or inferior view, I like to think it looks like a beetle. And why is that? Because I like to think it kind of looks like this spinous process right here is like the antenna of a beetle or the horns of a beetle. And I like to think these are like the eyes of the beetle. So this is one thing, a classic question that you might see on your lab practical or exams is identifying the different regions of, or looking at a vertebra and determining what region it comes from. And if you look at this, so again, the C1 and C2, those are the special atlas and axis. But the C3 to C7, they kind of look like this in general. Although the C7, the spinous process tends to be more prominent, and this is why sometimes it's called the vertebra prominens. So this is what's happening here. Yeah, or across. Yeah. So this vertebral prominence is also interesting too because it helps to anchor this ligament down here. So remember how I said whenever things like my whole dividing up bone markings into bumps and grooves. So the vertebral prominence is a very prominent bump. So remember sometimes bumps either fit into something or something grabs onto it. It's like an anchor. And what we see here is a nuchal ligament, and it's actually a very important anchor for this vertebral prominence. Helps to anchor this ligament. So this is why it also helps to keep your, if you let your head just go slack, why your head doesn't completely just go forward. This nuchal ligament helps to have some support for your neck as well. Okay, so just inferior, below the cervical vertebrae, we have the thoracic vertebrae. And thorax meaning chest, so this is where we have 12 of these vertebrae. Now what we have is now am I going to ask you what's the difference between the T4 and T5 vertebrae? Not really, but I think you should be able to recognize where a vertebrae comes from, which major region, cervical, thoracic, or lumbar. Now if you look at the typical thoracic vertebra is that, notice that you don't have the transverse process foramina, and notice that the spinous process and these transverse processes, they're shaped differently compared to the cervical vertebrae. And if you look at the side view of it, notice that it's kind of, the spinous process is pointed a little more down, and the vertebral body, in the previous picture with the cervical vertebrae, the vertebral body is larger in the thoracic vertebrae, and the foramen is actually slightly smaller. So I like to think of it this way. When you're looking at it from this way, I like to think that the thoracic vertebrae looks like a giraffe. I think the superior processes kind of look like the little nubs here on the. I only took one zoology class my whole life, so I don't know what those are called. I should look it up. But I like to think this is like the nose of a giraffe. And if you don't like it, then to get this analogy, you don't have to say, I'm not going to ask you what animal does a thoracic vertebra look like. Again, if this mnemonic works for you, great. If it doesn't, that's all right. Okay, but remember, what else do you find in your thorax? Well, you also find your rib cage, and notice that right here, you have on the sides of the vertebrae, you have the ribs articulating with that. So when your rib cage moves, they actually pivot on these vertebrae, and this is how your rib cage is able to, or part of the reason why your rib cage is able to inhale and expand, and also exhale and collapse. It's due to, partially due to the joints it forms with the vertebral column. Okay, and I like that hair across. I don't think I have that one yet. Okay, but anyway, so below the thoracic vertebrae, we have the lumbar vertebrae, and there are 5 in total. So with the lumbar vertebrae, what do we have here? Just check, they're called ossicones. Hey, I learned something new. Today I learned that the little nubs on the giraffe's heads are ossicones. Yeah, so it kind of looks like those. I like to think of it that way. The superior articular processes of a thoracic vertebrae looks like ossicones of a giraffe. So cool. Okay, lumbar vertebrae. So I'd like to use another animal. So what's bigger, or, well, not taller, but I like to look at the lumbar vertebrae compared to having a very, that thin, pointy spinous process. Notice that spinous process is kind of bulky, and the vertebral body of a lumbar vertebrae is also very bulky as well. So I like to think a lumbar vertebrae, if you're looking from the side, kind of looks like a moose. So the thick antlers of a moose are like the thick superior articular processes of a lumbar vertebrae. And spinous process is very thick. I like to think of it like a thick nose of a moose. And this little, I have to look it up what this little dangly part is on the moose, but I think it looks like this part of the inferior articular process as well. And hey, where do you find a lot of lumbarjack? Or what country is stereotypically associated with lumberjacks? Or where do you find a lot of woods? And where do you find a lot of mooses or mooses? Or is moose a plural in itself? Yeah, maybe I have to look that up as well. But anyway, so this is another mnemonic. This is why I brought up like the lumbar and lumbar jacks. I think, okay, then in Canada you have a lot of lumbar jacks and you have a lot of mooses as well. So I think of it that way. Or Alaska too. So it's somewhere in the Pacific or in the north. But yeah, you have a lot of mooses and in the lumbar area. So think of mooses in the lumbar yard. The lumbar vertebrae kind of look like a moose. Dewlap. Cool. Alright, so just like the moose is very thick, same with the body of a vertebrae from the lumbar vertebrae. So what that's have here is the vertebral body is very thick, just like a moose, and so are the processes. And why is that? Well, when you think about your spinal column and the way it's supporting all the weight, you want the thickest part, the most robust parts on supporting that weight. That's everything that's stacked on top. So you notice that the cervical vertebrae, since they're not only supporting really your head and neck, they don't have as much mass, but as you go lower and lower, you're supporting more and more weight on the vertebral column. So this is why you find that the vertebrae, they get chunkier and thicker as you go towards the bottom. Moose and meese, I like that. Okay, so then at the very bottom and inferior part of the vertebral column, then you have the sacrum and coccyx, and again, they start off in development as 5 and 4 vertebrae, and you can kind of see the remnants, but they fuse together. So they don't move independently once they're fused, and they kind of form this part. I like to think of the sacrum kind of like, if you've ever seen a hockey mask, I'd like to think of it as like a very weird sort of hockey mask with like all the eye holes and the breathing holes. And this is when people talk about your tailbone. Again, it looks like a little tail, but unlike that one, that boy that had the tail, our tails don't develop and they undergo apoptosis, so they don't end up like that. But yeah, that's what we see here is that the sacrum and coccyx, they start out as vertebrae during development, but they fuse into their own bones. Okay. So in terms of the other ones, so we have cervical, we have thoracic, we have lumbar. So what I like to think is like, okay, and again, I say C3 to C7 because the atlas and axis, the C1 and C2, have their own special sort of appearance and anatomy. So what I like to think of is this way. Well, what are general differences? Well, when we talk about our spinal cord later on, when we talk about the nervous system, it starts off thick and then it ends up thinner as you go from superior down to inferior. So notice that this vertebral foramen or foramina that where the spinal cord passes through, it actually gets smaller and smaller as you go from superior to inferior. So this hole gets smaller. And then what we have over here is that the vertebral body gets bigger and bigger. And why? Because again, the lower you go, the more weight your spinal column, your vertebral column has to support. So it makes sense that this part, this bony part where all this mass is and where everything is stacked upon, has more mass so that it can support more weight. So this is another general way you can determine which region of vertebra comes from. Is the foramen relatively big compared to the body, or is it very small compared to the body? So you see these changes in the vertebrae as you go from top to bottom. Right, so I like to, putting all these together, I like to think of it this way. This is my mnemonic, and again, if you hate the animal mnemonic, don't worry, I'm not going to ask you which animal does a lumbar vertebrae look like. But this is the animal mnemonic. So I like to think of this. Lumbar is the heaviest, the chunkiest, the most robust, and then the thoracic is in the middle, and the lightest is the cervical vertebrae, C3 through C7. And then you have C1, C2, and then C1. So I like to think of it this way. You have a very thick moose, and yes, I know giraffes are very big, but think of it this way. Maybe a little giraffe calf or a smaller giraffe. Balancing on top of that moose, and then a tiny little stag beetle on top. So this is why I think they look like that, and but this is like telling you in which order you find these vertebrae. Again, if you don't like this animal mnemonic, you don't have to worry about it, but some people love it. Okay, so speaking of the spinal column, let's talk about, so your spinal column, it has these curves and the primary and secondary curves. You can read more about that in your book. But there's also abnormal curvatures. So what we see here, let's just start with these three for this class. So scoliosis, kyphosis, and lordosis. So scoliosis, I mean, I don't know if they still do this in I think it was maybe intermediate school, but you might have had to go to the school nurse's office and then they run their hands down the back to feel the outline of your spinal column. So what they're checking is for scoliosis, and this is looking from the back and posterior. And what we notice with this person's spinal column is it's kind of like S-shaped. So it's not straight up and down. There is some sort of lateral curvature. So this is a very extreme example. And what she has right here is a brace to help correct it. And yeah, I have to find if there's like a picture of her even before she started using the brace, but this is what you see here. You see that kind of S-shaped curve to her spinal column, but I think this is actually after she got it corrected. So it was even worse before. So when these people like bend over, this can, or I had a gym buddy who had scoliosis, but it was uncorrected. So it's very interesting. Like when he did squats, he would actually kind of go to the side as he squatted down because of the curvature of his spine. So that's why I think that you see that scoliosis, S for scoliosis, but you have to be looking from the back. Or if it's reverse S, yeah, that works as well. Okay, kyphosis. So what do we see with here? Okay, now this it has a curvature, but this part right here is very exaggerated. So you might have heard it in layman's terms called like a hunchback, and this is a very extreme example here. And the medical term is kyphosis. So I like to think of it this way. Say someone's kicking you. Which way? Someone kicks you in the stomach. Which way do you hunch? Do you hunch back this way, or do you buckle forward? So I like to think of it this way. If someone kicks you, you typically double over and go forward. So kyphosis is when you hunch over and do that kind of like upper extreme curvature toward the anterior. Yeah. And then lordosis, so what do we see here? Well, notice that this curvature is really exaggerated on the lumbar region. So what we see now, do I want you to know the difference between lordosis and sway back? And actually there's one of the review articles I read had a little debate whether they're the same. I think there is a slight difference, but don't worry about for this class. More if you're like going to orthopedics. But I like to think of it this way. This is a mnemonic. So this is she's high, she's carrying. And what happens typically during pregnancy? Like, oh my God, my back is hurting. I mean, I can't say that because, yeah, that's not possible for me. But think of it this way, like, oh, her lower back is killing her, and she's thinking lordosis. My lower back is killing me. So think of that. So that's my mnemonic for lordosis. All right. Okay, so did all those vertebrae reference to Gen 2 Pokemon. I didn't intend that, but yeah, I'll claim it. Yeah, layers of mnemonics. Okay, so let's go with a little quick top hat question. Okay. All right, let's so this is an ordering question again. So you'll have to drag these in order, but I want you to stack these from top to bottom, superior to inferior. Lord has lower cross syndrome. Oh, I thought I started this thing. Oh, there's a little lag. Alright, so let's see if you can stack those animals correctly. And the correct answer, well, this is the most popular order, and the most popular order is correct. So again, cervical, thoracic, lumbar. If you like my animals, you have your little beetle on your giraffe, on on the big moose. And yeah, and then you have the sacrum and then the coccyx on the bottom. Alright, so let's continue with our lecture. And last but not least, we have our sternum and ribs. So the sternum we see over here, and it looks like this very gothic bow tie right here. So this isn't actually blood. I think it's just whatever resin that simulates cartilage. And what we see here is that the sternum has three main parts. So this part that's superior, this bulky part, is what we call the manubrium. And then we have the body over here, the sternal body, and then the xiphoid process. Now in this model, it's representing cartilage, but as we age, this xiphoid process starts to calcify and become bone. So in your grandpas and grandmas, they might be fully, like, as we become adult, this starts to not become cartilage and become bone. Now when you're doing CPR, what happens is that because you have this cartilage, there is some flexibility, and this is why you're able to compress the heart through the sternum. But at the same time, because you have this thin xiphoid process, oftentimes, sometimes it's not uncommon for that part to break off. But at the same time, do you want bone stabbing this person's internal organs, or even worse, their lungs? Yeah, so this is why you also have to check and listen to the person's lungs after you do CPR, because you're not only potentially breaking ribs, but also potentially breaking off the xiphoid process. But that's a little advanced. Okay. Alright, so the ribs, if you count them from the back, the true ribs are the ones going from 1 through 7, and then false ribs are going from 8 through 12. So what's the difference? You might be like, why are some true and why are some false? I don't know. I have to look up the history why they call it true and false, but the way you look at it is like, remember, the ribs have to attach. Okay, so this is, I think, shows better what the true ribs are and the false ribs are. So again, this is how you number them, going from superior to inferior. But if we're talking about what's a true rib and what's a false rib, so notice that the true ribs, the cartilage connect directly to the sternum. So again, you have the cartilage linking these ribs to the sternum, and true ribs 1 through 7, all their cartilage is linked to the sternum. Even number 7, which goes this way to the xiphoid process. Now, with 8 through 12, is that instead of the cartilage connecting to the sternum, they connect either to the cartilage down here. So they don't, again, these over here, they don't actually connect to that. They connect to the cartilage coming off from rib 7. And ribs 11 and 12, they don't even have the cartilage that connects to that structure as well. That's why ribs 11 and 12, so ribs 8 through 10, they're false ribs, and they're called the vertebrochondral ribs because the chondro, again, chondro meaning cartilage, is connected to other cartilage. It's not connected to the sternum. Now the floating ribs, they're easier to see from the back, but they don't have the cartilage that connects to the cartilage we see on the anterior. So if you look at from the back, that's how they are. They're kind of poking out to the side. So this is why they're called floating ribs, because they're not anchored with via cartilage to other cartilage or to the anterior or to the sternum. Yeah, are they more susceptible to cracking because it isn't the support of the sternum? And yeah, that's another big difference, is that because they have less support. Well, I guess it depends on what type of trauma you're doing. I would probably have to look up or look at statistics, like, do people who do contact sports break the false ribs more, or the vertebrochondral ribs more than the true ribs? Actually, well, yeah, that might be a good backpack question, actually. Like, if you look up traumatic sports, and if someone gets kicks to the sides and ribs, like, which ribs tend to break more than others? I imagine there's some difference, but I would have to look that up in some sort of sports or orthopedics journal. Okay, so then floating ribs right here. Okay, so we're done with our axial skeleton. Now let's move on to the appendicular skeleton. And floating ribs, I mean, can you remove the floating ribs? Oh yeah, so that would be interesting. Like, why would someone want to remove a floating rib or something like that? So yeah, I think that would be, I've heard that rumor, but yeah, I think it was like an urban legend. I heard that. I even heard that growing up in high school, like that rumor with, yeah, that certain entertainer. All right, So we have our axial skeleton, our skull, our hyoid, our vertebral column, and also our ossicles as well. But what's the appendicular skeleton? Pretty much everything else. So what we have here is like what we call the pectoral girdle or the shoulder girdle, same thing. And these attach the upper limbs, so basically your arms, to the axial skeleton. Now with the lower girdle, we have the pelvic girdle. And this is going to, the pelvic girdle is going to attach your lower limbs to your axial skeleton. So another way to think of like the girdles is to think of them like clamps. And where are they clamping? They're clamping your arms and legs to the axial skeleton. And that's what we have here. Okay, the next top hat question. Okay, so the next top hat question is, what's the opposite anatomical direction from medial? Oh, yeah, getting ribs removed for hourglass. I think I did see, I have to look it up, but I remember watching one of those, I know I watched too many of those like trashy reality shows, but I think there was this girl like who had the world's skinniest waist, and she wears these crazy tight corsets and her waist is like yay big. And I think she did get, I think I remember she did remove her ribs just so that she could put on that really crazy tight corset. And like the things people do for looks, right? But then again, that's why we have plastic surgery. Okay, so what did people say? Okay, so most of you said lateral and most of you are correct. So again, medial toward the midline, lateral left or right away from the midline. Yeah. I mean, I haven't watched all the episodes, but once in a while I do watch, like, especially if it comes on, or like if some YouTuber that comes up talks about, hey, I saw the craziest thing, then I watched the original episode. Okay, so what we have is, so these are important directions to come up with. So what we have is distal, going off in distance, and proximal, going towards center object. And then we also have lateral medial. So medial going toward the midline, and then lateral is either left or right. As long as you're moving away from the midline, this is lateral. Okay, so then what we have with the clavicle is that, okay, we're seeing here with the appendicular skeleton. So medial will be going toward the sternal midline, and lateral will be away from the midline. So with the clavicle, or like people in layman's terms, they call it or common terms, they call it the collarbone. Well, this is your clavicle over here. And what we see is that toward the medial side, it actually articulates with the sternum. So it does touch the sternum, and this is actually a very important anchoring point of the pectoral girdle to your axial skeleton. So this is what we call the sternoclavicular joint. And joints are like probably the part of anatomy that makes the most sense. It's very systematic. So just put sternum plus clavicle together and you get the sternoclavicular joint. So this is where the pectoral girdle attaches to the axial skeleton. It's not through the scapula. Now what we see here, now a common misconception is that they think that some people might think, oh, the clavicle is just a straight bone. But when you look at the sternal end, that's more medial, and the acromial end, which is more away from the midline and toward the shoulder. And remember, hey, acromion, remember that refers to the shoulder point? So what we see is that the clavicle is actually kind of almost like a gentle S shape, and we see that the sternal end that articulates with the manubrium of the sternum is definitely differently shaped than the acromial end we see here. Okay, so what we have here with the clavicle versus ribs, and a common misconception is confusing the clavicle with the ribs just below that. And here's the rib number 1, and what do you notice? Well, does rib number 1 really have that kind of gentle S-like shape? Not really. And notice that the ends of rib 1 don't look like the ribs of the ends of a clavicle. And with ribs 2 through 9, you don't see, they also have a gentle curve as well. They don't have that S-shaped curve like you see in the clavicle. So if you're seeing these bones in isolation, this is an easy way to tell a clavicle apart from rib 1 and the rest of typical ribs. Well, excluding like the weird ribs, like or I shouldn't say weird, like the other ribs, like the floating ribs. Okay, so then the right clavicle, and what we have here is that the clavicle actually articulates with the scapula over here. So a common thing that trips people up is that people think, for some reason, think the scapula is attached. Even though we're just seeing the skeleton here, you have muscles here, and you have all these muscles that anchor or are attached to the scapula. The scapula actually slides across this. This is why you're able to retract your scapula and hunch it forward. If the scapula was attached to your ribs, you wouldn't be able to move your scapula around. Or you may have heard the term shoulder blades. They're referring to the scapula. Now, the scapula has its own very interesting anatomy, and it's kind of like a rough triangle, but it has all of these bumps on it and also a spine on the back of it. And remember, whenever something pokes out from a bone, typically it fits into something or something attaches to it. And it's not coincidental that you have all these processes and parts of the scapula that form ridges and edges and bumps and projections, because actually a lot of muscles and tendons and ligaments attach to the scapula. So what we have here is now we're looking from the lateral side. So if you looked at the side of a scapula, the part that's away from the midline, and looking at that, you see this kind of smooth surface, a glenoid cavity, sometimes called the glenoid fossa. Do I care? This is another thing. Sometimes anatomists, they say like, it's glenoid cavity, it's glenoid fossa. I'm like, for me, I'm just like, just know both. It's some sort of, and at the end of the day, it's some smooth surface, and it's a smooth surface. Why? Because what fits into it is your upper limb. So you want a smooth surface so that your humerus, your upper arm bone, can fit in, the head of it can fit in there and rotate and glide within it. Now, if you look at the posterior of the scapula, notice that instead of having that very smooth fossa in the anterior, you have this big spine. And why do you have this spine, this ridge? Again, if you have a ridge or projection, something probably grabs onto it. And this spine is very important for helping to anchor a lot of muscles as well. So should you know all the parts of these bones, especially the ones I cover in lecture? Definitely. But again, there are smaller structures that I don't get to cover, so maybe focus on the ones that I do cover in the lecture. And this does pay off, especially when we talk about certain muscles. Now, this is, okay, so a little flashback right here. So what we have here is something called the Acromion, so little mnemonic time. And I wish I knew, when I lived in San Francisco, I wish that I knew that crows were super intelligent. And I saw this cool article where this little girl, she basically feeds the crows in her neighborhood, and they give her little gifts. And I think even her mom said like one time she lost something, and the crows, actually she found the lost thing in the food dish when the crows came back, because they realized that, hey, this family is friendly to us, let's take care of them, and oh, they dropped something, let's return it to them. So I was thinking like, okay, when I was the resident director for study abroad in 2019, we went to Ireland. Oh, and this is, I think, Canuck the crow. I think he's being missing and probably not good, but it's a really cool story as well. So I'm like, wow, people can befriend crows. So I was like, I'm going to Ireland. They have crows there, so let's befriend a crow. I'm going to try to befriend a crow within a month. So I went to Ireland, and then I ended up trying to befriend crows, but for some reason I befriended a certain type of crow. And where is this crow sitting? So this crow is sitting on me, but it's sitting particularly on my acromion. So I like to think of it this way. So I have a crow on me, and where's the crow sitting? The crow is sitting on my acromion over here. So that point of the shoulder, this right here, you can feel it actually. If you feel, this point, bony point right here, this is the acromion of your shoulder. So this is like, and it's also very important, especially if you're going to like orthopedics, definitely need to know that. And sometimes if you have to inject something into the bursa, like if you have bursitis in the shoulder, sometimes you have to do it in the subacromial bursa. Okay, so then, yeah, so I ended up befriending a different type of crow there. But anyway, so back to the acromion. So with the acromion, that's the point of your shoulder over there. So this is an important landmark. And hey, this crow is not, okay, the crow's chilled down a bit, and now he's like, okay, ready to talk. So this crow has a name, and he's a special crow because he has a name. And what's this crow's name? This crow is called Glenn. His name is Glenn, and why is this crow named Glenn? Well, where do you find the acromion? It's right above the glenoid cavity. So this is another layers of mnemonics, right? So the acromion sits on top of the crow sits on the acromion, and the acromion is above the glenoid cavity. So why is the glenoid cavity or this glenoid fossa smooth? Because again, that head of your humerus, your upper arm bone, needs to rotate through that. And again, when you have a smooth surface on a bone, typically something glides on it. Now, what is Glenn's favorite food? So Glenn the crow, he no longer has a knife, and now he's ready to grind and eat. So his favorite food is this. So his favorite food are apples. And what's left over after Glenn is finished with his apples? He leaves a core. So now after he's done eating his apple, he left the apple core in front of him. And why does he have an apple core in front of that? Well, because you have the coracoid process in front and anterior of the acromion. So here we have our crow here, Glenn the crow. He sits above the glenoid fossa, and in front of Glenn the crow we have the leftovers he has, that core. So he has the coracoid process in front of the acromion. So if you're looking at it from the lateral, here we have the acromion and the coracoid process in front. So this is the way I remember it, okay? Coracoid in anterior, acromion in the posterior, and then these surround the glenoid cavity. Okay, and in the back here we have the spine, and yeah, I know I went away for a while, and don't worry, don't tell Mr. Peanut, he'll get jealous about this. Okay, so then in the back we have the spine. So in the acromion, we have going from the acromion toward and this is looking at the posterior of the scapula, and going toward the medial side, we have the spine. Now, again, it's kind of like the spine of a book. It's a very thick ridge, and again, with this ridge, it helps to anchor a lot of the muscles found in that area. Okay, so what we have here is the supraspinous fossa. So it's a smooth surface, and actually it forms a surface that helps to attach one of the important muscles of the rotator cuff. And then we have infraspinous fossa. So again, supra is like it has the same root word as superior and above. And below that we have inferior or infraspinous fossa. Now over here we also have another fossa. Now we're flipping it around and looking at the anterior. And what we have here is the subscapular fossa. What the subscapular fossa is, and why do I point out these fossa? Well, if you're going to any sort of physical therapy, guarantee with any new patient, or any day in the clinic, you're going to deal with someone with a rotator cuff injury. Super common injury in physical therapy and orthopedics. So what we have here is the supraspinous fossa, and then so supraspinous fossa, and then the rotator cuff muscle that attaches to this is what we call the supraspinatus. And then below the spine, we have the infraspinous fossa. And if this is the supraspinatus that attaches to the supraspinous fossa, let's talk, what do you think we should call the muscle that attaches here? Maybe we should call it the infraspinatus. And the subscapular fossa, what should we call this, the muscle that attaches here towards the anterior fossa we see here? Maybe we should call it the subscapularis. Now, the thing about the rotator cuff muscles, there's a fourth rotator cuff muscle, and it attaches to the lateral border. Now, if we want to, this is where there's a little sort of break in the system. I mean, it would be very nice if we could just be systematic and name it lateral bordoralis, but at the same time, it's like, okay, it's just called the teres minor. So this is one thing, is like, most of it makes sense, and this is why it's important to know these landmarks, because sometimes other structures like muscles, nerves, blood vessel, they might be named after these landmarks. So, but at least for the rotator cuff muscles, you get 3 for 4. You just have to know the exception right here with the teres minor. I know, it's like, for some reason Nightbot doesn't like caps, so I'm still trying to find out to work with the code to allow him to allow a certain amount of words. Anyway, but back to where we're going. So this is a classical mnemonic, and this is why if you've shadowed in an orthopedics or physical therapy clinic, you may have heard it called the sits muscles, referring to this entire group of muscles. But when I teach this mnemonic, I also make sure that this is a lowercase t. And why is it a lowercase t? It's reminding you that it's not the teres major, it's the teres minor that attaches to the lateral border and helps to form the rotator cuff muscles. So this is like okay, speaking of rotator cuffs, so can skeletal anatomy. So the thing is that skeletal anatomy your skeleton forms important attachments and support for all the muscles to provide leverage and help in their function. Now with the acromion, what we have here, remember the acromion sitting on the point of your shoulder. So there's actually different types of morphology, and actually in the anatomy in general, you find that if you end up going to graduate school or medical school or physical therapy school and you get to work with cadavers, you'll find that everybody has slight variations in anatomy, and the acromion is one of these that can have slight variations. So let's do a quick top hat question. Let's skip that question. Okay, all right, rotator cuff injuries. Okay, so there are different types of rotator cuffs, or acromial shapes, and actually there's 6 of them, but I'm only showing you 3 for simplicity's sake. Which of these do you think is most prone to rotator cuff injury? Let's add a little more time. Okay, let's see what the class said. So the class said, so it seems split between type 1 and type 3, so whether it's kind of like this or whether it has an exaggerated hook. And this is a little complicated. So type 3 is actually more prone to rotator cuff injury. Yeah, it looks very similar, but I know it's funny because it's very slight differences, but there is a difference. And if you look at the statistics, so what we have here, there's actually multiple types, but let's just talk about type 1, 2, and 3. And notice that as you go from type 1 to 3, 1 is the flattest, and then 3 actually has that little hook at the end, or actually toward the anterior and superior part of it. Now the prevalence just refers to like, okay, how often do you find this in the human population? So this flat acromion is kind of rare compared to the other two, and these you find them about equal proportions, like maybe a little more on the type 2 in people in general. Now, in terms of rotator cuff tear cases, if there wasn't a correlation between the shape we would see the same percentages. But in terms of rotator cuff tears, what they find is that people who have flat, they actually have a lower chance of getting rotator cuff tear compared to people who have curved. But the people who have the hook, they make up the majority type of the people who get rotator cuff tears. So I have to find the original. Let's see, maybe I have it in my old archives, but in the journal I was reading this from, so that's why, like, okay, just by having a different bone morphology, this makes some people more prone to this rotator cuff injury. And I think, if I remember that journal correctly, they were talking about possibly shaving the bone to make it more of a flat morphology right here in shape, so that would make it less prone to tearing, especially for athletes who have this hook shape, and in like sports like baseball where you're doing a lot of upper arm and upper limb movement, maybe they want to make this athlete less prone to a rotator cuff injury. And let's see. Oh, so we're over time. I'll cover the humerus. I don't think we can cover the humerus in this little short amount of time. So I'm going to save this all the rest of the appendicular skeleton for Friday and next week Monday. So take it easy for now and see you all on Friday. Yeah, so that's range and motion type 3. So yeah, I think I have to read that if they talk about range of motion. But I think if I remember, it's been a few years since I read that one, but I think they think it snags the ligaments and the tendons, and that's what that kind of like makes them more prone to these tears. All right, so see you all on Friday, and take care until then. And even if you didn't do as well as you wanted if you want to do higher on the exam one, don't give up. I mean, in the end, I always look at the big picture. All right, so I know we're all trying to get through October, and yeah, rooting for all of you. See you on Friday.